Right, so PDO threads, what are they? So PDO threads are polydioxanone. This is a sugar molecule that is molded into the shape of a suture, and there's a whole range that we can choose from. My personal favorites are the smooth type and then also the cogged press type. They have different indications. Really the cogged type are what we associate with the concept of a PDO thread lift. That when we insert one of these threads into the subcutaneous plane, so the superficial fatty tissue, it causes two things. It causes neocollagenesis, which is the process of stimulating collagen production, particularly type 1 collagen, which then later is formed into type 3. And then we also see controlled breakdown of the fat. So where we see heaviness in the jowls, we can use that to help create collagen and then contract and tighten the fatty tissue down. The other type is the monothreads or the smooth threads. These are really good at helping stimulate collagen within the more superficial layers near the skin, and can also be used when at higher numbers, so when we're using 20 to 30 at a time to help with controlled fat contraction as well. The cog threads are going to be better for patients who have more heavy facial fatty tissue, so people who are in their late 30s onwards. The smooth type of threads are going to be better for young people where we just need a little bit of collagen stimulation, so people in their late 20s to early 30s who are starting to notice skin quality and structural changes. So the areas of the face that I'm trying to treat when I'm using PDO lifting threads is we're trying to treat the inferior jowl getting heavier, and then also ptosis or migration of the nasolabial fold and the mid-cheek fat pad down and forwards. And what it's going to do, particularly in this inferior jowl, it's going to help tighten and contract by breaking down the little fatty cell lobules, and then also put down collagen. There is a ligament that sits here called the mandibular ligament that helps keep this jowl into place. And when it gets weaker as we get older, it does allow for this jowl to drop down and forwards. Now, as with everything in minimally invasive treatments, it's important that we get on top of the age-related process early on. If you present and your jowl has already migrated down, the likelihood is that the result that we're going to get is not as significant, and we may be looking at surgical treatments. But if you catch it early, particularly for patients in their 30s to 40s, or if you're a well-maintained 50-year-old, there is absolutely a great chance that we're going to get a good improvement by inducing controlled lipolysis and stimulating collagen within these areas.